Hello, my name is Caitlin Cox. Thank you for coming to my capstone presentation. This is Behavioral Health Programmatic Standard Operating Procedures. Behavioral health is defined as mental health and substance use disorders, life stressors and crises, and stress-related physical symptoms. The goal of behavioral health programs is to help families and individuals live healthier lives in terms of their minds, bodies, and overall health. Developing and implementing a successful behavioral health program via request for application can be structured using literature reviews. However, a comprehensive manual of operational needs does not exist. In this body of work, I will assess the behavioral health workforce's need for an operations manual, the reason such manual is necessary for the successful execution of behavioral health programs. What is an operations manual? An example of an operations manual is included in this body of work and is intended to lead a behavioral health professional through the necessary steps of program development, including developing a proposal, releasing a request for application, intaking applications, grading applications, disseminating notices of award, and then all of the additional communications that follow in engaging approximately 50 to 300 grantees and stakeholders. The intended audience for this body of work and this manual is intended to be behavioral health workforce professionals within a foundation or organization who are in the initiation stage of developing a behavioral health program. These roles may include, but are not limited to, program managers, grant administrators, evaluators, application reviewers, and all other personnel responsible for overseeing the grant application and award process. I myself currently serve as a senior operations manager for a behavioral health program that is being administered across the state of California via federal funding. Mental health issues are continuing to rise, giving way to the formation of various behavioral health programs. The 2021 National Survey on Drug Use and Health says that 47.2% of adults in the US with any mental illness, and also referred to as AMI, received mental health services in the year 2021. These statistics come from SAMHSA. The Coronavirus Response and Relief Supplemental Appropriations Act of 2021, CRISA, also referred to as CRISA, has given funds to states to address these behavioral health issues in their communities. The influx of federal funding requires states to have programmatic standard operating procedures that can help them quickly and efficiently stand up behavioral health programs. The reason this is important is that federal funding has come very quickly towards the states at the state level, and states have to be able to have the administrative capacity to stand up their behavioral health programs. They often don't, and as a result, they need to reach out to subcontractors who are able to act as the administrative entity arm of their operation. In addition, these arms can also be put on severe timelines to be able to deliver a program quickly at the behest of the state, especially because if these funds are not used and spent down quickly enough, they will be lost and the federal government will resume control of the funding. Without strong operational procedures related to the administrative development of behavioral health programs, there's a risk of losing the funding and or misallocating funds to areas of public health that are not as impactful. So it's important to be able to put the money in the right places or use the money as quickly as possible, but it's also important to make sure that it's targeting the right communities who need help and that the funding isn't going to communities that are not as in need. This can be done by having operational standards, and I will get more into that in a little bit, but it's important to have these standards so that you can hit the ground running when you're trying to stand up a behavioral health program. The problem statement. Without strong operational procedures related to the administrative development of behavioral health programs, there's a risk of losing funding and or misallocating funds. There are very few studies in support of programmatic or operational standards related to behavioral health programs. And in addition, there's no content such as a manual or a document library that consists of step-by-step instructions for the development of a behavioral health program from an administrative lens. There may be occasional pieces of content that are available online, templates and examples, but they're not held in one particular document library that is necessary for this type of funding and for the behavioral health programs that need to be stood up quickly. There's an exorbitant amount of literature focused on how to best implement a strong behavioral health program. However, these reviews often focus on the program itself and neglect the operations that are executed in the infrastructure of the project to make the programs impactful. So for instance, behavioral health programs and how to properly engage your grantees is something that is highly often reviewed. There's a ton of literature about it, but there are processes that happen in the background to ensure that these programs are executed properly. And that is where the process or the body of knowledge for that is lacking. There's a growing need for continued research to inform current trends on behavioral health programs, on standard operating procedures, and interventions to address them. This manual would be utilized by program managers, administrators, staff members within government agencies, or administrative subcontractors who are responsible for overseeing the grant program. They would use these operational standards to initiate the project as outlined in the manual and to disseminate the request for application, select grantees, effectively manage the grantees throughout the behavioral health program. The objectives of this capstone were to investigate the level of knowledge among behavioral health workforce regarding the utilization of standard operating procedures. There are a lot of folks right now working in the behavioral health sector who are passionate about the programs that they run, but not necessarily operationally minded to be able to make sure that these projects are executed properly. And that was one of the pillars of this capstone. Establishing the benefits of standard operating procedures in behavioral health programs. And my last objective is to explore the resources to be used for the implementation of behavioral health programs. I conducted a study of a cohort of 257 behavioral health workforce employees. But before I go into that, I just want to make sure that I define behavioral health as according to SAMHSA, which is the promotion of mental health, resilience, and well-being, the treatment of mental and substance use disorders, and the support of those who experience and or are in recovery from these conditions, along with their families and their communities. Behavioral health workforce includes psychiatrists, psychologists, marriage and family therapists, and social workers. It also includes professionals such as peer support specialists and community health workers, all of which often work in these administrative positions for subcontractors and or administrative entities that are developing programs for the government. To complete the study, I administered a series of questions to 257 behavioral health workforce employees who currently work for a behavioral health consulting firm. Participants in this questionnaire hold various positions within the behavioral health workforce, including program directors, program associates, and operations associates. My goal in administering this questionnaire was to understand the level of awareness among behavioral health professionals regarding operational best practices and resources, and whether or not they understand how important these processes are and how integral they are to the proper execution of a behavioral health program. Questionnaire specific. So for the purpose of this questionnaire, operational best practices are defined as a digital library of standard operating procedures, a strategic communication plan, a template of grantee and or public facing documents, standardized work breakdown structures, standardized risk registers, and or standardized timeline templates that can be used to produce a Gantt chart. This definition was given to all questionnaire participants before they had taken the questionnaire. And operational best practices could be any of the items I just listed. The questionnaire was distributed to 257 behavioral health workforce participants who currently have program responsibilities within a behavioral health project. I want to make sure that that is noted. These are not just behavioral health workforce participants. These are folks who have program responsibilities within a behavioral health project. So we had a small cohort of program directors at 14% answering the questions. The largest cohort was program managers, who are at 50%, and the 36% of the folks who participated were program associates. I'm going to go through the results of the questionnaire to speak through what the questionnaire participants felt in their perception of operations, standardized operations procedures. And then we will conclude with results taken from that. Do you have an understanding of operational best practices as defined above? That is a reference to the definition I just gave. 46% said yes, where 54% said no. Have you ever used any of the materials related to operational best practices as defined? 62% said no, 38% said yes. Would standard operating procedures help you to implement your program effectively? 83% said yes. This is one of those questions that signals to me that there is a need for operating procedures within many of these projects, but folks just don't know where to get those resources. Would a strategic communication plan give your program participants and/or grantees clarity in their programmatic responsibilities? 91% said yes. Behavioral health program success is often dictated by the communication strategy that you have towards your grantees, so that you are able to communicate to them what the expectations are of them outside of their scope of work and their contractual obligations, but so that you're able to almost lead a long-standing class for 1 year, 2 years, or however long the grant period extends for. When beginning a program, do you use a standardized timeline of deliverables and/or a work breakdown structure? 19% of folks said yes, 81% said no. This in and of itself is a very large issue. Every single project, regardless of length of time, dollars spent, number of grantees, should have a work breakdown structure available to them. Do you build timelines for your programs based on scope of work deliverables from scratch? 95% said yes. This is in juxtaposition to the previous question about a work breakdown structure. If a timeline exists, it is relatively simple to put that timeline into a work breakdown structure. Part of our piece of the problem is that folks just do not have the either the template or the examples to be able to build their own work breakdown structure for their project. Do you currently use templates for webinars, constant contact communications, and/or learning collaboratives? 55% said no, 45% said yes. Webinars and constant contact communications, learning collaboratives, etc. These templates are necessary because they give the program itself a polished look, and they allow for the grantee to understand what the expectations are if they're well executed. Do you currently use templates for, do you use standardized implementation materials for your grantees? 8% said yes, 92% said no. When creating evaluation materials for your program, are you using logic models? 78% said no. This is important because data models and just evaluation materials in general should always have a logic model built into them. That is the way that you are able to assess the project health of your project and/or make sure that your grantees are getting the training and technical assistance that they need from the grant period. Would standardized evaluation materials assist you in administering your program? 78% of folks said yes. That makes sense to me. I think any type of standardized materials at this point would help behavioral health programs to succeed. As I said, there just is not enough examples and/or standardized processes out there. And lastly, the most impactful standardized operation materials. This is a question asking which they would find the most helpful. And you'll see 131 participants said that evaluation templates would be the most helpful example and/or template provided to them as a standardized material. So The benefits of standard operating procedures and behavioral health programs is quite clear. They're an integral part of the success of behavioral health program implementation. One study done by McGinty et al. Conducted a comprehensive review of the literature to summarize the quality of medical care for the U.S. population living with serious mental illness, with an aim to identify the sources of variation in the provision of quality health care. They used peer-reviewed studies between the year 2000 and 2013, which yielded a total of 778 articles. A sample of 23 articles was reviewed and summarized. The findings of the study were that the quality of care varied with the rate of adherence to the guidelines, also known as operating procedures. McGinley found that the rate of operating procedures adherence was lower than the estimated general U.S. population. Therefore, the operating procedures manual is essential for the behavioral health program runners to follow in order to improve the quality of health among their grantee cohort. In addition, Dress conducted in 2016 a randomized trial of integrated behavioral health homes to compare the quality and outcomes of patient care. The trial was conducted through a partnership between a federally qualified health center and a community mental health center, where a total of 447 patients having serious mental illness were under the behavioral health home or usual care for 12 months. The patients in the behavioral health homes received integrated care on site by a practical nurse. Compared to patients who received usual care, behavioral health home patients showed a higher rate of improvement than those who received usual care. This is another example of where standardized processes that were available to a healthcare provider had better results for the participating behavioral health. So the audience for this manual is intended to be persons responsible for the successful implementation of a behavioral health program via a request for application. The manual can be used by all levels of responsibility and scope. The manual is presented in the form of an Excel spreadsheet hosted in the Google Sheets platform, and all links are accessible by the general public. I would like to note at this time that while this was created through the lens of a request for application, the manual could easily be applied to a request for information, RFI, or a request for proposal, RFP. I would like to take this time to show you the Behavioral Health Programmatic Standard Operating Procedures Manual. If you click this link, it is available. This is the standard operational template. This gives you the task that you may be working on, the template and the examples for each thing. These are all clickable links that go back into the library, the Google library that I've created for all of this information. We've got different phases of a program disseminating the RFA. You can see that right here. Review process, the NOA dissemination and grantee onboarding, which is very lengthy, and then the contracting process. In addition, a program kickoff and what that should look like. So I've included all of templates and self-assessment surveys in here, contact rosters, how to set those up, how to email the grantees about the NOA, what that should look like. I've given examples of review rubrics in here for how to be able to review an application in the most standardized way. I've also given templates for post-info webinars, regular info webinars, and Q&A question and answer modules that should always be provided to the grantee. Okay. So in conclusion, the intended results here are to examine the level of knowledge regarding behavioral health programs and their standardized operating procedures and the availability of step-by-step instructions for the execution of a behavioral health program. I also wanted to establish the need for a behavioral health programmatic standard operating procedure manual for program staff and use standard operating procedures to develop a comprehensive step-by-step manual, which I had just demonstrated. The study concludes that the level of knowledge of behavioral health programmatic standard operating procedures is minimal, but the behavioral health workforce appreciates and recognizes the need to develop and adopt these standards. Instructions, templates, and examples that are easily adopted are the preferred format of standardization. Increased usage of standardized processes can help increase project health and directly impact the successful implementation of behavioral health programs. And the adoption of standard operating procedures can also be aided in the organized and accurate collection of clean data. As technological advances continue to spread in the public health sector, data will become the most integral part of targeted community outreach that can have the largest impact on grantee needs. Lastly, the core competencies demonstrated in this presentation and the capstone are the first being communication, select communication strategies for different audiences and sectors, communicate and audience appropriate, public health content, both in writing and thorough and through oral presentation, leadership, apply leadership and or management principles to address a relevant issue. Such principles may include creating a vision, empowering others, fostering collaboration, guiding decision-making. Lastly, the MPH health policy and management specific core competency is health policy and management concentration competencies, applying relevant theoretical conceptual models and leadership principles to develop health policy and administer health programs, identify and discuss the partnership and collaborative skills needed to develop effective public health programs and policies, and apply strategies for advocating for effective public health policies and programs. Thank you so much for coming to my presentation. I appreciate your time and feedback.